Hello, my name is Sinead. I work in Sir Charles Gairdner Hospital. Currently working in Haemodialysis unit, and I am acting SDN at the moment. Previously was a registered nurse, and yeah, really enjoy it here. I previously worked in a paediatric setting, Sir Charles Gairdner Hospital. It's great for professional development. I'm currently undergoing a master's in renal nursing, and yeah, the unit has been really supportive for that. Work in a real fast-paced, dynamic environment, so always plenty to learn. Sir Charles Gairdner Hospital are really good for continuing safety and quality healthcare. We're currently doing an initiative for a new heparin chart. We give our heparin through the machine during dialysis to prevent any clotting. So this is more prescribed by the doctors, the heparin chart, and it's just a clear kind of framework of how we're going to safely administer the medication. I've worked as a nurse for 8 years. I qualified in Ireland after 4.5 years undergraduate. I worked predominantly in paediatric nursing in Melbourne, Sydney Children's, and then I moved to Perth Children's Hospital. So got loads of experience in a lot of patient care. The trends have changed dramatically over the years, but I guess the core values are always kind of driving healthcare. And Charlie's, yeah, they an excellent place to be working. There's always loads of opportunities for professional development, and the care is always really patient-centred here in the unit. We know our patients so well because we see them about 3 times a week. So yeah, it's a really nice place to work. I guess healthcare is always changing. What we recognise really in this unit is that the volume of patients coming through the unit. We have an extra shift, which is the mid shift, in order to accommodate. I also believe that the acuity is becoming a lot higher, and patients are coming from very far areas to come to this in-centre unit. The staffing has stayed pretty the same, but yeah, I guess there's just a whole lot more patients coming through, and we just need to be able to cope for that, which I think we're doing quite well considering. I think haemodialysis is an excellent area. It's quite specialised, but I really think you can learn so much. Even when you're qualified 5 to 10 years, there's always a lot of scope for learning. The University of Tasmania actually do a certificate, diploma and a master's, which is excellent, and it gives you a great foundation for the whole renal if you're hoping to stay in it. But yeah, I think it's an excellent place to work. Really good team here in Sir Charles Gairdner Hospital. Management are super supportive if you ever want to kind of progress or anything like that. I love nursing. I've been in it for 8 years now. My mum was actually a paediatric nurse as well, and my dad's a doctor, so I think I've grown up in that kind of environment. But I really couldn't imagine doing anything else. We know the patients so well here as well, which is lovely, and it's real patient-centred. We try everything to make their time as good as it can be here, because it's so tough being on haemodialysis. When they get transplanted, it's obviously a lovely time, but for the majority of the time we're just really here at their bedside giving our best care. So I'm super sporty. I love running, triathlons. I also play Gaelic football over here in Perth. So I have some nice time with some Irish people. But yeah, Australia is amazing in that sense. There's always loads to do. I also do yoga teaching in my spare time, which yeah, keep busy outside work too.